The following program is for informational and educational purposes only. This program does not replace medical, mental health, or psychological diagnosis and treatment prescribed by your personal physician, psychologist, therapist, or other healthcare provider. Please consult your provider for diagnosis and care before beginning or changing any program or idea discussed.
Welcome to Recovery, the Hero's Journey. Your host is Dr. Patricia Halligan. If addiction or prescription drug dependence affects you, directly or indirectly, whether it's you, a family member, or a close friend, stay tuned over the next hour as we explore substance use disorders, process addictions, and prescription drug dependence. We'll be discussing the painful reality behind these disorders and what can be done to help. Now, here is Dr. Patricia Halligan.
Welcome to Recovery, the Hero's Journey. I'm your host, Dr. Patricia Halligan. Several of our episodes have focused on the epidemic of overprescribing of benzodiazepines. That's Valium, Xanax, Klonopin, Ativan, and Z-drugs, Ambien, Lunesta, and Sonata. The percent of long-term benzodiazepine prescriptions have increased over the past 10 years. The dosages are increasing. So 1/3 of all opioid overdose deaths in America involve benzodiazepines. Xanax is implicated in 1/3 of suicides. People can be severely injured by therapeutic doses of benzodiazepines, that is, taking their medication at therapeutic doses as prescribed, and suffer a myriad of painful, disabling side effects while trying to stop, and can be left with long-standing or permanent neurological damage. This is an epidemic causing human suffering of epic proportions and derailment of human lives, ongoing for decades, yet little or nothing has been done to stop this plague by those with the responsibility and the power to do so. My guest today is a man who is trying to change that. Shane Kenny is a broadcaster and a journalist who worked for 30 years as a frontline presenter and editor for RTE, the Irish National Broadcaster. In 1989, he won the Irish National Media Award for supreme contribution to Irish journalism. During the years 1994 to 1997, he served as press secretary for the Irish government before returning to RTE. In 2003, he established his own independent media business in production and training. From 2005 to 2011, he was also director of public affairs and member of the executive board of Dublin City University. The last 3 years, unable to work because of serious illness caused by being treated with Valium for Meniere's disease. Shane started working on his unique documentary, The Benzodiazepine Medical Disaster, in 2014 while still very ill, and continues to suffer from the disease caused by the drug to this day. He joins us today from Achill Island, which is off the west coast of Ireland. Shane, thank you so much for joining us today. I'd like to honor and thank you for all the work that you've done and continue to do on behalf of people around the world harmed by the overprescribing of benzodiazepines. Welcome.
Well, thank you for having me on your show.
I've only been to Ireland once. Now it's 3 summers ago. My daughter came to me and said, Mom, I'm going to have a small wedding in a castle in Ireland. So I thought I was lucky with a small wedding, but it ended up in a castle called Castleknock outside of Dublin. And what a beautiful country you have.
Well, thank you very much indeed. And this is a lovely part of it anyway. You have watched the documentary that I made, Benzodiazepines, the Medical Disaster.
I have, and I recently rewatched it, and I just absolutely love the passion behind your film, and I also love your style. You're refreshingly honest and straightforward in your delivery. You say things that need to be said. Why do you think that government bodies, health services, medical authority, doctors, and academia have not reacted appropriately to this benzodiazepine medical disaster?
Well, I find that profoundly disturbing and shocking. It's an epidemic in the United States. It's a pandemic all over the world. the benzodiazepine medical disaster. There are dozens of activist campaigning groups all over the world about this, and in the United States, some very, very good ones in your country. I want to put it in relief with the current COVID-19 pandemic and the vaccine. Experts say there is a 1 in a million chance of having a blood clot with the J&J vaccine, Johnson & Johnson, and a 1 in 100,000 chance of a clot with the AstraZeneca vaccine. The evidence we've got from the clinical work of Professors Heather Ashton and Malcolm Lader on benzodiazepines is that there's a 1 in 3 chance of patients sustaining serious health impairment with benzodiazepines if they take it for more than a few weeks, 4 at the absolute most. When it happened first to me, I couldn't believe the level of medical ignorance there was about something so serious that it was a threat to my life. My general doctor, first of all, and then my consultant said they knew nothing of such injuries from benzodiazepines. The consultant who prescribed Valium for Meniere's disease tried to deflect it by suggesting that it was something else. And that's a very common and ignorant reaction by doctors, I'm afraid. I've come across it hundreds of times over the past 13 years that I've been both affected by and researching benzodiazepines. After I spent 2 months in the famous National Urology Hospital in central London, I got a written report saying that I was suffering from benzodiazepine withdrawal syndrome, and that's the only time that the doctors faced up to the truth. I interviewed these 2 doctors, 2 professors, Heather Ashton and Malcolm Lader, in 2014, and one of the reasons why I wanted to do it before my health had recovered at all, and it was quite difficult to do that, was because they weren't being replaced. These were 2 psychopharmacologists who had devoted a very great deal of their lives, Heather Ashton practically her whole career, to investigating benzodiazepines and trying to help people who were suffering from them. And I found it extraordinary that they weren't being replaced and that health authorities were doing nothing to abate this pandemic.
And it's still the same today. As an addiction psychiatrist, my office is inundated with desperate people banging down my door, saying, please, please help me get off Xanax, help me get off Klonopin, help me taper off Ativan. These drugs, they're worsening my depression, or I'm developing panic attacks in between my doses. I'm taking it as prescribed. And, I don't think clearly anymore. I'm fuzzy-headed. My memory is disturbed. I'm running a company. I have a gentleman who just had to recently retire prematurely before the age of 65 because he had been on Klonopin for 2 years, and it just destroyed his memory and his executive functioning ability. And what the patients tell me, I liked what you brought up, Shane. I like this medical ignorance as a big part of the problem. Anna Lemke, MD, who's the medical director of Stanford Addiction Medicine, we were talking and we both agreed neither one of us was taught anything about the harms of benzodiazepines at all during our med schools or during psychiatry residency. So no education about the harms of benzodiazepines. We were taught how to prescribe, but not how to deprescribe. And I think your point about doctors not understanding the problem, I see it every day, and it's not a rare problem. So I love that you compared it to the pandemic. It's a big problem. It's not rare, and the suffering's been ongoing for decades.
Exactly, and I think it's because these drugs were invented. First of all, towards the end of the 1950s, and and then changed into the 1960s. I mean, the kind of tests which had to be done on medications which were visited on people then were incredibly slight. Professor Malcolm Lader makes quite something of that in the documentary. But despite that, there was, I think, as you'll have seen, there was a survey done by Leo Hollister, Dr. Leo Hollister, in 1960 and 1961. The first benzodiazepine was launched on the world, Librium, by Roche in 1959, 1960. And he, felt that it needed to be tested and that that it couldn't be entirely safe as people were representing it, of course he fed it to I think there were patients in a military hospital in California, almost a prison, but I mean there were patients who he had access to, and as Lader said, we would consider it a kind of an unethical thing to do today. But he gave triple a normal dose of Librium to the patients in the hospital, to a selected group of them, gave them for 3 months, and then abruptly stopped, of course, to see what the effects of that would be. And of course, it was pretty traumatic for the people who had been taking the drugs. A number of them had seizures, and they had all kinds of symptoms presenting at that stage. And he wrote up a very, I suppose, light touch report on what he found. But the medical establishment and the drug companies didn't react to it at all. You would have imagined that in this situation where people had seizures after the drug was stopped, that would give them some pause, but absolutely none.
It is shocking. It boggles the mind. I was recently watching Medicating Normal, the documentary from 2020, and Robert Whitaker, who I know you're familiar with, he was talking about a Xanax study that was done in the 80s, where they basically showed that Xanax decreased people's anxiety and panic at the 4-week mark, but they suppressed the remainder of the research conclusions at the 14-week mark. After people had been taking Xanax for 14 weeks, the anxiety had risen considerably, and that was suppressed. It was not made public knowledge. I'm not sure why the drug companies were so invested in suppressing the information about the harmfulness of benzodiazepines. It is shocking. I agree with you there.
Yes, I think Robert's work has been amazing, actually, in this field of psychoactive medicines. He also runs Mad in America, the website, of course, which publishes a lot of material on this. In fact, published an article of mine last December, about the FDA's new stand on benzodiazepines, which I want to talk about at some length. But he really is to be complimented for what he has done. There's no doubt about that. I wonder, you have you seen the article I did for Mad in America and other websites about the FDA's new stand on benzodiazepines? Because I mean, it's extraordinary to me that an organization like the FDA, which has a responsibility for looking after people's health and safety in relation to drugs, that they could do an investigation of people who've made complaints to their site. There are about 300,000 complaints that they've had since they first started getting these kind of complaints about benzodiazepines. 300,000. It's an enormous number. And people taking the time to sit down and write.
And that's only the reported number. How many went unreported?
Yeah. Yes, I'm sure there's a lot more. There's certainly a lot more people who have been affected by benzodiazepines. But I mean, the critical thing was that they didn't investigate the 300,000 complaints. They did a subset of 104 cases, which they said, covered some of the main aspects. But that leaves something begging, I'm afraid. But what they did find, even in this 104 cases, was some very dramatic things about benzodiazepines. In particular, what I consider to be the really, really serious issue, which the FDA and other health organizations have never confronted, and that is that the side effects can continue for years and years, and probably permanently, but certainly possibly permanently. We just have no studies done on the kind of damage and harm that has been done to people over very many decades. And of course, people don't understand, doctors don't understand. Sometimes they've shut their ears to people coming into their surgeries complaining about the drugs that they've been prescribed, causing them these problems. They refuse to believe it. And in some cases, of course, as you know, they throw the patients out literally. They won't treat them. But I mean, I want to read the words which the FDA itself used in describing what they found, that people had suffered severe withdrawal side effects that had lasted from weeks to years. That's long-term harm.
It's devastating. And what does this cause? How does this derail the patient's lives?
Well, I mean, there's an awful lot of people who are like me. I mean, it put an end to my entire career. I was still continuing to broadcast regularly. I was the director of public affairs in Dublin City University, one of the leading technology universities in Ireland. And I also had my own media business in production and training, and everything went within 6 months of me being affected. Most people would find it hard to conceive of how awful it is to be affected by these drugs, which have damaged the central nervous system, and your entire central nervous system is malfunctioning, and you're living in that body. As Dr. John O'Connor, an Irish doctor and expert on benzodiazepines, told me, his phrase for it was that your body becomes your own torture chamber. And all of your sensations, sound, touch, the sensation on your skin, inside your body with your veins, it's like having a continuous electric shock, or certainly it was for me.
Oh, that is torture. That is torture.
It's absolute torture. And there's no way of stopping it. I mean, people who give electric torture to prisoners, they have to go away and eat sometimes, and they stop. But there is no stop. And that's one of the reasons why people take their own lives. It's
unbearable, isn't it?
It's completely unbearable.
Yes, for years.
It very nearly was like that for me. And thankfully, a friend of mine called me. I was here on this island at the time. A friend called, and he was so shocked after our conversation that luckily for me, his brother was my neurologist. And he got off the phone to me and got on to the neurologist, who then got on to me. At this stage, I had been off I'd gone through my first withdrawal, and I had stopped the drug for 5 months. I had tapered. I'd followed all the protocols. I had tapered very slowly from a very small dose of Valium, 6 milligrams a day, down to 3/4 of a milligram over 6 months. And at that stage, I stopped. It certainly was extremely damaging to me in the sense that I lost the ability to walk properly during that time because the pain in my legs was just so bad. I got to the end of the 6 months. I was at 3/4 of a milligram. I was given an assurance it can hardly be doing very much to your body at that stage. And I stopped. And within 7 days, I had a seizure.
Oh, how terrifying.
It was utterly terrifying. I had a seizure at about 2. It woke me up, first of all. And I was literally frozen from my head to my feet. And I couldn't move in bed. Of course, normally, if such a thing happened to you, you feel you could ring the emergency number, for emergency help. But I couldn't do that. Even, I had a mobile phone beside the bed. I would have been able to dial 999 is our emergency number. But I couldn't do that because I knew at this stage that the likelihood of someone having a seizure, they were likely to give me a benzodiazepine. I'd be dealing with people who would have very little interest because they're so busy. They'd be trying to get through the workload, and they wouldn't know any better.
No, they wouldn't. So wow.
I had to sit in my bed for 6 hours until things started to unwind a little bit.
It's terrifying when the whole medical community doesn't know how to treat this, and you become your own best expert, right?
Yes. Well, undoubtedly. That's the case. In fact, Heather Ashton, when she was dealing with our clinic, setting up our clinic, she ran a clinic. Of course, we haven't mentioned that for 12 years in Newcastle upon Tyne in the north of England, specifically treating people with benzodiazepine problems and trying to help people to get off them because people desperately wanted to stop taking these drugs. It has often been said, that they create a craving. Of course, they don't create any kind of a craving, which is like what people get for alcohol or heroin or cocaine. The craving is for something that will avoid them having to go through these terrible withdrawal symptoms.
They really just want to alleviate the withdrawal, and they desperately want to get off these benzodiazepines. These are not people that are addicted.
And it's not just what I've been describing already, but there are a whole range of symptoms. Tinnitus. You can get numbness. You can get burning pains in your limbs. You can get inner trembling, vibration, very strange skin sensations, muscle pain, weakness everywhere, painful cramps, jerks, spasms, stabbing pains, these electrical currents, as I talked about. And, Heather Ashton found when she opened her clinic first, all of her patients, all of them had difficulty walking.
And these are patients with oftentimes no prior psychiatric history to speak of. They're just the worried well, and their doctors.
That's correct.
Something for a normal day, everyday anxiety, a little bit of work stress, maybe tension in their relationships, a little bit of anxiety. This is normal life. But were you told about the possible side effects of long-term neurological damage or a severe protracted withdrawal syndrome when you were prescribed Valium for many years?
No, not only was I not given any kind of warning, I said to my consultant when he said benzodiazepines, Valium, he said Valium. I only had a vague idea of this, but I said, "Isn't there a problem with Valium?" And he came back at me and said, it's the most maligned drug, and it is very good for this Meniere's condition. And in fact, he said it could act as a preventative if I took it for a period of time.
Sign me up. I would have taken it. Sign me up, right? I mean, you rely on your physician for accurate knowledge.
Well, that's it. There's definitely a range of reactions to benzodiazepines. There's no question of that. And, one of the things that has helped doctors to avoid doing anything about it, or even accepting that they can cause terrible harm and damage, is the fact that 2 out of 3 people might not have any difficulty with this at all. In terms of getting off them, they might have some side effects when they stop, but they don't have the really serious conditions. But I mean, 1 in 3 being liable to the possibility of this is a very dangerous proportion.
We're going to take a short break. We've been talking to the creator of the documentary Benzodiazepines, The Medical Disaster, Mr. Shane Kenny. When we return, Shane Kenny will share his thoughts on the revised FDA black box warning for benzodiazepines. We'll see you back in a minute.
Treatment of opioid use disorder is a CME-approved video for healthcare professionals. This comprehensive video covers how to talk to patients about 3 FDA-approved treatment options, the research behind each medication, and how to help patients choose the right medication for them. You'll learn everything you ever wanted to know about these treatment options to be able to treat patients in your office with ease. This video simplifies the prescribing of buprenorphine and includes buprenorphine home induction instructions for patients and pamphlets for patients and their families. Visit drpatriciahalligan.com for more information. Benzodiazepines, the epidemic we aren't talking about, is a CME-approved video for healthcare professionals. This very comprehensive video describes the dangers of taking benzodiazepines and Z-drugs long-term and teaches how to deprescribe them safely and effectively. We outline how to talk to your patients before, during, and after a long, slow Valium taper, how to build your patient a village of support, and offer a deprescribing toolkit. Find out more about this package and what it includes. Visit drpatriciahalligan.com. You are listening to Recovery, the Hero's Journey. If you or someone you love struggles with a substance use disorder or prescription drug dependence and would like information about resources that can help, please contact one of the following organizations: the American Academy of Addiction Psychiatry, the American Society of Addiction Medicine, or the Benzodiazepine Information Coalition. Now, back to Recovery, the Hero's Journey.
And we're back to Recovery, the Hero's Journey. I'm your host, Dr. Patricia Halligan. We're here with Shane Kenny discussing benzodiazepines, the medical disaster. Shane, I wonder if you'd like to comment on the FDA's recommendations for a new black box warning that came out last fall in 2020.
Yes, I would certainly like to do that, because I developed an interest in what the FDA was up to when I was alerted that they were proposing a black box warning on benzodiazepines. I mean, they already had one, of course, about the use of benzodiazepines with opioids, but this was going to be about benzodiazepines on its own. Mm-hmm. But then when I looked into the matter, there was a positive and a negative. The positive I've already spoken about, which was that they carried out this research into the complaints that had been given to them under the FAERS. Isn't that what it's called?
FAERS, yes.
Yes, yeah, the Adverse Event Reporting System that they have, the FDA Adverse Event Reporting System. Mm-hmm. And they found really three central issues in relation to benzodiazepines, even from just looking at 104 of these cases. One, that there was a long-term injury being reported, that people suffered from, and not only from for weeks and months, but years as well.
Mm-hmm.
They also referred to the fact that people were getting what they called a physical dependency on benzodiazepines, and having severe side effects as a result of that when they withdrew from benzodiazepines. And then, of course, they also discovered, it seemed for the first time, that people could have seizures from benzodiazepines, particularly if they stopped abruptly.
Mm-hmm.
And they wanted to warn against that. So, they were good things. They looked into the complaints. They'd said, oh, there's evidence of long-term harm here, that people can suffer very bad withdrawal effects and become dependent on these drugs. I want to go into the dependency aspect of this in a moment.
Mm-hmm.
And of course that there could be seizures. But they labeled the whole thing about what they were seeking as they wanted a warning, a black box warning about abuse and misuse.
They missed the point.
Benzodiazepines.
They missed the point.
Yeah, well, it's almost as if they deliberately missed the point. I'm reluctant to say that, but I mean, it appears so often in their literature about benzodiazepines that they have this focus on abuse and misuse. I mean, abuse is a totally separate thing.
And that is
people
not
going to their doctors and having a therapeutic prescription for benzodiazepines as a result of visiting their doctor about some complaint or other. But I mean, what the FDA is doing is opening the door all the time to consider anybody who has a problem with benzodiazepines has abused the drug.
And they treat the patients who come to them and say, I think I'm developing more anxiety on therapeutic doses. And the doctor sometimes interprets that wrongly to the patient's drug seeking. The patient wants more drugs. They're blamed. The patients are blamed when they develop a problem that won't go away. I think the doctors feel inadequate if they can't fix the problem, if they don't understand the problem, and then they want to get rid of the patient or label the patient as either drug seeking or crazy. It's really sad. There's a lot of patient shaming. I think you wrote that in your article in Robert Whitaker's Mad in America.
Yes. Well, now, patient shaming is a terrible thing. And for a health agency like the FDA to expose itself to that kind of criticism, I think is stupid on their part. Or it may be that there's another and a more malign reason for it,
Sure, let me have it.
Yeah. Well, first of all, in relation to the black box warning, they were asked in 2010 by a citizen's petition, which is open to people to do, to the FDA, a petition signed by 7,000 people, I understand, and Heather Ashton's name, Professor Heather Ashton, probably the greatest expert on benzodiazepines in the world, was right at the top of that. She wanted the petition wanted a black box warnings about all the things that we've been talking about here: long-term harm, long-term injury, the fact that people can get very, very serious side effects, some of which I've listed there. There are dozens more.
Yes.
And people who are suffering really badly from benzodiazepines, the 1 in 3, will suffer maybe 12, 15 of these different symptoms. It's not just one. There will be a whole plethora of symptoms that they suffer. And of course, there are people who have had seizures which could kill them. Thankfully, my seizures, and I've had 4 in total because of benzodiazepines. They haven't killed me, and I didn't kill myself because I got very good advice to go back on the drug rather than, continue to try and fight it in my first attempt to stop benzodiazepines. So, I mean, there are people who have stood by all the time. They refused everything in that petition, that citizens' petition in 2015. But not only that, for decades, they have been refusing to even act on these hundreds of thousands of complaints that were being made to the FDA about benzodiazepines. And of course, they have refused to limit the use of them to 2 to 4 weeks. Now, even the drug companies in Ireland and Britain, as far as I know, and I think throughout Europe, are now all putting that in their information, that a strict limit to 2 to 4 weeks, if you're on long-term prescription of benzodiazepines, anything over 4 weeks is long-term with benzodiazepines, and you're in danger.
Totally. Now, on the black box warning, did the FDA recommend how to taper? Did they give any guidance on what a long, slow taper means? Because I don't think I saw that.
No. They hedge on that.
They do.
Because
that's what doctors don't know.
They want doctors to make up their own minds about what the patient can endure.
Well, that's scary.
Now, it is scary, and I think the advice should be there that they should be willing to take a very long time. And they should also, this is the patients and the doctors, and I'm talking about years, not 6 months, which I tried first of all. On the second occasion, it went from, it went for double that anyway, a year. And then I did have assistance from other drugs. And at that stage, I had been 2 months in the National Neurology Hospital in London, one of the famous neurology hospitals in the world. And they'd looked at all the neurological symptoms that I had, and they prescribed medications. I mean, the 2 that they used with me were Lyrica and amitriptyline.
And were they helpful?
No, not really. The amitriptyline was just a waste of time. Yep. But the Lyrica, yes, in the sense that it did take an edge off the symptoms, but only a vague edge. I mean, it made it bearable, or I think it provided a crutch to lean on.
And if you were
a psychological crutch.
And if you were going to make changes to the FDA warning, if you were writing it, what would you put in big capital letters? And what would you advise doctors to tell their patients? Somebody's coming to you saying, "Doc, I can't sleep. Doc, I have panic attacks. Doc, I have anxiety." What would you like? What kind of clear message would you like to deliver?
Well, the clearest message I can give is that the black box warning should have nothing about abuse and misuse on it. It should be aimed at protecting the people who are going to get therapeutic prescriptions of the drugs. The black box warning should say something like, "Do not take for more than 2 to 4 weeks.
Perfect.
Risk of serious long-term disabling injury."
Perfect.
And on the other side, it should say, do not stop abruptly, risk of seizure and death.
And who in their right mind would take it if the doctors told them, this is what I have to tell you, this is an informed consent?
Exactly.
Who would take that medication?
Nobody.
No,
Nobody.
I certainly wouldn't.
I think there's very little doubt that a lot of people would find another way to get out of their anxiety or deal with their insomnia. Some people who would take them would definitely not go beyond the 2 to 4 weeks. If it was, put up in highlights that if you go over 4 weeks, you could get a serious long-term disabling injury, and further details of that. They include a section which is called protracted withdrawal syndrome, way down, of course, in the literature about the drug. And in some, in the Ativan case, it says in some cases, benzodiazepine users have developed protracted withdrawal symptoms, with symptoms lasting weeks to more than 12 months.
Well, weeks to years, and maybe never, and maybe permanent.
And there's no research to show whether or not these symptoms will end. The other thing, of course, the FDA should be absolutely pressing the drug companies to do is to carry out that research. I mean, they were lamenting in the coverage of benzodiazepines, they were lamenting the fact that there's no epidemiological study of benzodiazepines. They should demand it, that the drug companies do that. And in fact, you'll recall, Patricia, in my documentary, The Benzodiazepine Medical Disaster, Malcolm Lader put it up to Roche that they should, out of past profits, and of course, Valium was the biggest selling drug in the world.
Oh, $1 billion
industry.
Yep.
They made a fortune out of it. He said, out of past profits, they should now consider their position and fund some research into the effects, the long-term effects of benzodiazepines, which of course too, you'll have seen, I got the British Medical Association to sign up to a statement saying that not enough is known about the long-term effects of these drugs. And the problem with psychoactive drugs is that, they really don't know very much about what the drug is doing to the whole brain. They know maybe what it's doing with receptors or some pinpointed areas, the way benzodiazepines bind to the benzodiazepine receptor. We have the benzodiazepine receptor in our brains, and what that does in relation to the production of these receptors. And they all down-regulate when benzodiazepines come in. Heather Ashton speculated that it's as a result of that the central nervous system functioning is damaged by benzodiazepines, because they don't. When the drug is taken away, the brain doesn't recover its production of the right kind of processes within the brain, which have been managed effectively by the benzodiazepines when they're there, and when they're taken away, the brain's normal functioning does not return.
And this is 1980s and 1990s that Heather Ashton gave it to them on a silver platter, according to your documentary. I heard it in her own words. She said, I have a clinic in Newcastle with 300 people on long-term benzodiazepine prescriptions, and I have 300 of their family members not on benzodiazepines that can serve as the control group. Why don't you take my people and you can tell me, investigate the long-term effects of benzodiazepines? And Malcolm Lader said, hey, alcohol hurts the benzodiazepine receptors in the brain. So does the GABA receptors in the brain, and so do benzodiazepines probably. So my studies, I think he had some brain scans showing abnormalities of his patients on long-term benzodiazepines, and he suggested, as you said, further research into long-term harm. And these proposals by Dr. Ashton and Dr. Later, since the 1980s and 90s, totally disregarded, rejected, ignored. This is enraging.
Yeah. It's really it's shocking to contemplate, what suffering might have been avoided and lives saved if the Wellcome Trust and the British Medical Council had listened to the warnings by Professor Lader and Professor Ashton. I mean, it is just unbelievable that they couldn't treat this problem as serious. Again, it draws in this possibility that people are defending positions that they have been maintaining for, decades. Some of the people's hands may be dirty. They'd prescribe benzodiazepines themselves, and they'd had patients.
Yes.
People sitting on boards and all the rest of it. And they had people coming in and they said, oh, no, it's all in your head. You're imagining this. People were... no wonder some people must have committed suicide because they found that they couldn't even get through to the doctor, to understand what a horror, what a nightmare of suffering they were going through. It is frightening, and as you say, it's enraging.
Yes, it is. And I think, Shane, the worst thing, I'm glad you said frightening, the worst thing that I've ever seen as a psychiatrist is unwitnessed, invalidated suffering. So the whole time you're telling us your story, you're telling us the story of a man who's misdiagnosed. The doctor doesn't even know that Valium could harm you. He doesn't understand why you had a seizure. You're lying in bed, scared to push the call button for fear that they load up more benzos. They don't understand. So you're in this all by yourself. You're becoming your own best expert because the medical community doesn't acknowledge your pain. So you're all alone in this, and you feel like you're losing your mind. Now we're almost out of time. We've got about 1 minute left. Any closing thoughts?
Well, I think we've covered the story as well as we can for the moment, but that is true. People are still looking the other way, and I wonder if the campaigners are going to have to have different tactics, because it's all been carried out in a very gentlemanly fashion for the most extent. There's the World Benzodiazepine Awareness Day every year. Some events are staged for that. I think more direct action may be necessary to, beat on the doors of these people and say, what are you at? Where's your head been for the last 50 years? For instance, Leo Sternbach, and I don't blame him, he was a scientist, but he's the man who discovered the benzodiazepines, which led to Librium and Valium and all the rest of them. He's now in some museum. There's a museum of industry success where he's being celebrated because of the financial reward to the makers of Valium, and to the fact that this drug became so widely used and so widely prescribed. That's an insult to
yes, it is.
Those people who have been really seriously injured and harmed, their lives ruined by these drugs. And these I hasten to add again and again, these are the patients who were prescribed the drugs by their doctors, and they took them as prescribed, and they never had informed consent. They never knew what the dangers were of taking these drugs. The other thing, as a final thought, which I'd like to add to this, is that the language around which these drugs, the language around these drugs needs a bit of review as well. To talk about people like, for instance, the FDA does, about people forming a dependency, a physical dependency. What's actually happened to them is that they have a physical damage done to their central nervous system.
Yes.
And that is causing the myriad of all these side effects that I've been managing to tell you about. There are many more. Anybody who wants to know about the symptoms, read Heather Ashton's work. They'll find it all there. Mm-hmm. We shouldn't be using, campaigners shouldn't be using this kind of language either, dependency, addiction. Right. Addiction yes. has a terrible stigma in the public mind, I wonder if people who suffer from fibromyalgia, which is very similar to the side effects of benzodiazepines, have been taking benzodiazepines and are suffering side effects of benzodiazepines. Nobody yes. has done a study of that.
It's
egregious. It certainly deserves it.
Well, I can't thank you enough for coming today and telling us your story. I will never forget the picture in my head of the man in the hospital bed having had a seizure and afraid to push the call bell button because the doctors didn't know how to treat him or they were going to do more harm. This is a problem indeed of overprescribing, of medical ignorance, turning the other way. It is useless, unnecessary suffering of masses of people that is caused by physician prescribing. So thank you very much for your thoughts, for your insights, and thank you again for being a heroic, strong, bold, brave voice, advocating for judicious prescribing and standing up for all the people across the world that have been harmed by benzodiazepines.
Well, thanks for your kind words, Patricia. I'm not so sure hero is the word, but survivor.
Well, that's heroic in my eyes. If you can survive the world of overprescribing and survive benzodiazepines, you're heroic in my eyes. So thank you so much, sir.
Okay, well, thank you very much for talking to me about the subject. It deserves a lot of airing. My pleasure. This is Recovery, a Hero's Journey, and I'm your host, Dr. Patricia Halligan. Thank you for joining us today.
Thank you for joining us this week. Recovery, the Hero's Journey, is broadcast every Tuesday at 12 noon Pacific Time and 3 p.m. Eastern Time on the Voice America Health and Wellness channel. As you wait for our next program, remember, you are definitely not alone.